Thank you so much for having me, Deepti. I really appreciate it. And I really appreciate you giving healthcare providers a platform to communicate to the public exactly what's going on in hospitals. So I just want to extend that appreciation. Thank you.
Of course. And it's so important for us to right now raise awareness about COVID-19 and its impact, especially with what's happening with the current political climate of this country. There's a lot of questions I have today on what you think will happen now with all these protests and these huge gatherings happening across the nation. But just starting off this interview, we're looking at over 105,000 deaths in this country. And we're looking at over a million people that have been, that have gotten COVID-19. My question to you is, at this point, is this curve truly flattening? And, while we're moving towards a reopening, is there a concern for a surge in cases or a reoccurrence, perhaps?
So yeah, that's a great question, and that's what we've been debating both in medicine and in the public for the last couple of weeks. Now that things are reopening again, is what's going to happen? Is there going to be a second spike? We've done a great job at staying home, flattening the curve. I would say that my brother-in-law is an emergency medicine physician. My sister works in the ICU, and they're not seeing any more real COVID admissions because COVID essentially is now manageable, and we're able to deal with it, as we would deal with a regular medical issue. However, now that things are starting to open up again, you have these protests. It's summer. Bars and restaurants may open up again. Who knows? It's really difficult to say. Most of the medical community does anticipate another spike.
Right.
It's inevitable given that it's summer, given that things are opening up again, given that now there's this added layer of protests on top of that. And I do want to say, peaceful protests, I'm all for it. Just make sure you protect yourself. There's good guidelines online about how to protect yourself during a protest, especially given a pandemic going on. And make sure you're wearing a mask. Make sure that if you're sick, to stay home. Make sure you stay socially distanced. These things are really important. If we're going to go out in the public and reintegrate into society, it's very important that we make sure that we do so safely and we take care of ourselves and the people around us. And I think that there should be more of a public awareness campaign as to how to reintegrate yourself into society. And I don't think we're doing a great job with that. I think we did a great job with the messaging about staying home. But what about this next phase? We need to make sure that when the public decides that they're well enough or that they feel comfortable going back out, how to do so in a safe manner to protect their family, protect those around them. So I think it's going to be a very interesting to see what happens. I have high hopes for how we deal with this from now on, now that we've learned all these lessons from the initial spike of COVID. But it's really difficult to say what's going to happen. But however, most of the research anticipates that there's probably going to be another spike. Hopefully we can manage it better this time.
I just want to have a follow-up question to these protests and these mass gatherings that are happening in the nation. Strictly from a medical point of view, right. Should these large gatherings at this point of COVID-19 and its impact on the country, should these be happening right now from a strict medical point of view?
So that's a tough answer, right? You're really weighing medical versus social issues there. And I think it's a very personal choice as to how important a certain cause is to you and what you would do, what sacrifices you would make to demonstrate for yourself or on behalf of other people. It's difficult for me to answer. Obviously, from a medical perspective, it's not optimal to have these mass gatherings given that we have a pandemic going on that's highly contagious. But there is a safe way if you're going to protest to do so. And there are, I can perhaps share with you afterwards, there's guidelines online of how to safely protest during a pandemic. And I urge all the viewers to look into that if they decide that they're going to protest. But yeah, it's really, during a protest, you're not going to be spaced 6 feet apart. You're yelling, you may have a surgical mask, you may be yelling, respiratory droplets may be emanating from you. It's difficult to say what kind of effect that's going to have. And often you don't have control of the environment, especially when there's police there may be violence there. And also from the health perspective now, it's very important if anybody's thinking about protesting now that police are using tear gas and other substances to kind of disperse crowds, wear a mask, both just to prevent yourself from contracting COVID, but also it could be tear gas is very harmful for your eyes, and you want to protect your mouth, your nose, and your eyes. wearing a mask and a face shield is very important, or goggles, anything to really protect your eyes.
You have been redeployed to the front lines. You are a dermatology resident, but you're currently working with COVID-19 patients. You know, with 2 months of a battle, basically, it's been for all of the medical workers. Could you sort of describe this journey for our viewers, where you were in the beginning, and how do you feel right now that the curve has flattened now? New York can take a breath now, perhaps. I would love for you to discuss that with our audience.
Yeah, New York City has been the epicenter of this COVID pandemic, not just for the United States, it's for the world. I think that I looked at the statistics, I think, a couple days ago, and we comprise 1/4 of all deaths in the United States. So it's a very sobering statistic. And I'm a dermatology resident. I primarily treat the skin. My specialty isn't in the ICU. However, before we become dermatologists, we do 1 year of general medicine training after medical school. And luckily, I spent 2 weeks training in the ICU, so I had that background under me to help me through this process. As a physician in New York City, there was a shortage of doctors during the height of the pandemic. My sister, as I said, is an ICU resident in Long Island. Her husband is an emergency medicine physician in Manhattan. My dad is an urgent care physician in Queens. So
Wow.
all of us were on the front lines at the same time. They obviously were dealing from things from day one until the spike and then afterwards. I was called in much later as a reinforcement because they just didn't have enough general medicine physicians to deal with this pandemic. So my hospital had asked for volunteers because we didn't have the manpower to deal with all the new cases that were coming in.
Right.
And, I felt I was born and raised in New York. I went into medicine to help people. My whole family is on the front lines. It wasn't a choice for me. It was a responsibility to really help out in any way that I could. And so it was, essentially what happened was we converted our pediatrics unit in the hospital into a COVID unit. And I was working along pediatricians, ophthalmologists, radiologists, doctors that haven't seen general medicine in a really long time or not familiar with it. And it was terrifying, but it was also extremely rewarding for us to all come in together and help out for a common cause. It was really, no one had ever expected it, and it was something that it changed you. You go in every day. You didn't know if you were going to get sick. You didn't know if there was going to be PPE. You didn't know how your patients were going to do after you left them overnight, the last night. There weren't enough resources for patients just because we're dealing with a pandemic and our hospital only has a limited amount of resources. It was definitely a experience I'll never forget. Just to talk about getting sick while treating patients, it's a very real thing. My family was heavily affected by COVID. My sister contracted COVID while treating patients. My dad contracted COVID while treating patients. And it was, for my sister, luckily there were milder symptoms. For my dad, who was much older, it was, we forced my mom to leave the house while me and my sister were deployed and moved in with my father to help him concurrently to make sure that we could do everything possible so that he didn't have to go to the hospital. And my dad's a trooper. Since day one, he was treating COVID patients. Even when he got sick, he would just treat COVID patients from home.
Wow.
Via telemedicine. And as soon as he got better, as soon as his symptoms resolved and he was out of that kind of infectious period, he just went straight back to work.
Wow.
So everybody was just kind of all hands on deck at the time. We didn't know if this pandemic was ever going to subside. It was during the peak. We weren't flattening the curve at that point. We didn't know how bad it was going to get. No one had anticipated that it was going to get this bad ever. Looking back on it, even in early March, my sister, her husband, me, I never thought that I would ever be deployed. And then once we were deployed, we just didn't know when it was ever going to end, if it was going to end. So it was, I can't even put that experience into words. But to watch my colleagues and the other healthcare workers in the hospital, everybody go through this together and just help out for a common cause, it's been one of the most rewarding experiences, in not just a medical professional, but as a New Yorker. So it was intense, but luckily, luckily we are out of that, and hopefully if we do have another spike, it will be much more manageable.
What is the current status of PPE and other supplies that you need in the hospital? And in terms of just reflecting upon all that has happened, Doctor, what are some of these uncertainties that are still not being solved, and some of your concerns for the next few weeks?
So I think when it comes to PPE, we've had great success with donations from the community. At the height of the pandemic, we were using anything for PPE. My brother-in-law was using garbage bags. I luckily had no real issues at my particular institution with PPE. Actually, that's not true. When I first was deployed, we ran out of gowns. And so that was a real big issue, especially because when you go into a room, you have to change. Normally, under normal circumstances, you have to take the gown off every time you go in and out, and you have so many workers going in and out. Immediately, nobody had anticipated a pandemic, you would run out of gowns. So that was a real big issue. When it came to N95s, yeah, there was a shortage and they were heavily rationed, but luckily the community has been great. And we've been very lucky to have a big medical community across the United States, and other institutions that weren't hit as hard, like in California. There were really amazing med school friends that I had that would just ship or coordinate shipping PPE from California, all the places around the country, to New York for the pandemic. And we actually used my sister's apartment as kind of a supply chain to supply most of Manhattan's hardest hitting hospitals. So during the height of the pandemic, yeah, there was definitely a shortage of PPE, but I can definitely say that right now that we do have enough supplies. However, if there's another wave, things can get hairy again, just because I don't know what the production line is, what the status production line is, especially now that things have calmed down. Hopefully things improve, but we'll see.
What about trials and all of the drug trials that have been happening, as well as your take on vaccine? Dr. Anthony Fauci has been very optimistic about having a vaccine by the end of this year. A lot of work has been invested into it. What information could you give us about that?
So Anthony Fauci has been great. He's been, even before this whole pandemic, what he did during the AIDS pandemic, what he's done for medicine in general. Our medicine textbook, the internal medicine textbook, he's the first author. Just in terms of learning medicine, that's who you went to. And so I have huge respect for the man, for the physician. And I think that overall he's done a great job at guiding the nation, especially when there's mixed messaging. When it comes to clinical trials, especially during a pandemic, everything's changed. Everything is rushed. There's not the protocol. You don't go through the same protocols and checkpoints that you would do with any normal drug. And so it's difficult to say what works or what doesn't work. It was very unique when you're deployed on the wards and you're treating patients with drugs that you've never known to be proven before, because usually in medicine you have guidelines for everything. And so every week, every day that you would go in, something or the other would change. And we spent a lot of time analyzing all the trials, analyzing all the research, trying to figure out what works and what doesn't work. When it comes to trials, I would say that caution is very important. I think that it's very easy, especially in the press, to announce that a trial is working or not working without the real scientific process of actually looking at the data and determining whether this was a good study or wasn't a good study. When it came to hydroxychloroquine, obviously, the medical community heavily against the way that was touted. I'm not saying that hydroxychloroquine doesn't work, or not saying that it does work, but I'm saying the trials that were put in place were not assessing things in the proper way. There may be a use for it in a prophylactic method. We don't know yet. The answer is we just don't know yet, because there's not good trials that show yes or no in any sort of direction. When it comes to other things like convalescent plasma, when it comes to remdesivir, other types of medications, there are tocilizumab. There are trials that show promise, but nothing remarkable, nothing that's going to totally change the way that we treat this disease process. I think one of the real things that we started to understand about the disease is that rather than check fever, rather than check cough, check someone's oxygen level. That's the most important thing. If you have a pulse ox at home, if you can find a pulse ox, if you feel like you have symptoms, that's the most important thing to really check whether you have any respiratory issues because sometimes it can be silent. When it comes to medications, when we're on the hospital, when we're deployed on the wards, what we found, what was really interesting is in this case, is we didn't know why all these patients had such, their blood basically clotted very easily. And we didn't understand why. So now we're using anticoagulation in the hospital. These types of things are drugs that we've had forever and we've been using for, heart attacks, we're using for deep vein thrombosis, so vein clotting, and now we're using it for this particular disease. No one had anticipated it, but it's been, we think it has a positive effect on treating patients and helping them get over the hump. But there's nothing really at home that is going to prevent the disease or anything that you can take at home. However, doctors are coming up with ways to manage it in the hospital via the medications that we have. We don't have any studies necessarily to prove one way or the other definitively, but the early evidence shows that some of these medications, some of these treatments do help, but only time will tell as to whether these help in the long run.
Well, this disease just continues to be a mystery for us all. In
Right.
terms of looking at it from a dermatology point of view, have you found any skin manifestations of COVID in patients, or is there an interaction between people that have skin diseases or other issues related to their skin for them to be also contracting COVID?
Yeah, so it's very interesting in the dermatologic community because no one had anticipated that a rash would be part of the disease process. This was a completely respiratory issue. But then in February and March, we started seeing more cases of rashes. And there's a huge debate in the dermatology community amongst all the skin doctors as to whether there's a rash with COVID, whether there's not. And a lot of people will hear about this entity called COVID toes, and it, in the media, and they liken it to frostbite. And initially, I honestly didn't believe that there was any skin manifestations of this disease. However, recent evidence shows that there probably is a rash associated with COVID. And it basically, you get like these red or purple bumps on the toes, on your toes. You can get them on your hands, but predominantly on your feet and toes. And they can be a marker of COVID. Now, we don't necessarily know what the clinical significance of that may be, but when we look at the studies, it shows that usually patients that have this have already had COVID and now are recovering from it most likely. However, they may still be infectious. So if you do have something called COVID toes, what I described, I would go see a dermatologist. I would go see your primary care doctor because it may be a sign that you do have COVID and you may need to get certain types of testing. You can either get the swab testing or you can get the antibody testing. Also, you might need to isolate yourself because other people in your household might be contagious. I'm not saying that these are any formal guidelines yet. However, they may be. And then there's a push in the dermatology community to make these part of the testing guidelines. So we'll see.
What about the inflammatory syndrome that has been found in children that is also producing a rash on their body? Any comments on that?
Yeah, so that rash is similar to Kawasaki disease. And so that's a rash you see in the pediatric population. I can speak from the rash standpoint. Usually you get a rash kind of all over your body. That's only present in about 50% of cases. And it's a very new syndrome. There's a lot of research going on it. It can be very serious. You can get red eyes. You get changes in your hands and your feet. You can get enlarged lymph nodes in addition to the rash. And so there's certain signs that are indicative of that disease. However, we don't really know if it's necessarily tied to COVID, and I don't think anybody's really proven that yet, but there is a spike in these weird cases, and we don't really know how to explain it. And so however, I also want to say that the prevalence of that syndrome in kids is very, very low. The concerning thing is that some of these kids can get very, very sick. They can end up in the ICU because they don't have the blood pressure to sustain the cardiovascular support. They may have respiratory issues. And so the vast majority make it out of the ICU. I think that in New York City, there's only reports of about three kids that have passed away to the disease out of everybody that was hit in the community. So it's a very low mortality rate, but it's still concerning because these are kids. We want to protect them. So we don't really know what's going on, but we're doing our best. We know how to treat it with the cardiovascular support. They need to be put on a breathing machine. They'll be put on a breathing machine. But luckily, it's very, very, very low risk that any of your kids get the disease. However, they may be contagious. Kids still can probably pass on the disease. So it's important to make sure that you tell your kids to wear a mask when they go out, to stay 6 feet apart. I know it's hard to tell your kid anything, but if you can try to educate your kids that that's very, very important, I think that you could do them and also the community a great service in limiting the spread.
You know, we are coming towards a close of the interview, but I just have a few questions left. Number one is I have to discuss looking at the social climate right now with the protests happening across the nation due to the death of George Floyd, and looking at so many conversations of racial disparity, inequalities in our system. I wanted to bring forth a little conversation on the racial disparity you may have seen when treating your COVID-19 patients. They have said that minorities have been disproportionately impacted by COVID-19 in terms of access and also the positive number of cases. Your take on this, and what should we understand about it, and what is needed from the healthcare system to truly solve this issue of racial disparity?
Yeah, so it's really unfortunate about the events that are happening right now in our community, and something needs to be done about it. From the medical community standpoint, there are huge racial disparities in terms of how healthcare is provided, and this has been known for a long, long time. However, I think due to the social injustices that are going on now, the medical community is looking inward to see what can we really do to help that. I work in Brooklyn. Most of my patients are skin of color, patients of color. I would say greater than 95%. And so, I work at a hospital that's funded by the state or the city. And so we may not have all the resources at our disposal to treat this patient population. So, patients that are of color or African-American populations, they have higher risk of heart disease, higher risk of diabetes, higher risk of lung problems. They grow up in lower socioeconomic backgrounds. They may not have insurance. And especially when it comes to the pandemic, most of them live in the city. Most of them live in high density areas, so they're more likely to get the disease. Because of the insurance issues, they may not seek a doctor or seek medical attention. They might have higher risk factors, so they're more likely, if they get the disease, to unfortunately have worse outcomes even in the hospital. And the hospitals that they go to may be understaffed. They might have less resources. And so there's a lot of things working against the African-American community in our cities. And we as physicians, we as a community need to do a better job at highlighting what's going on that's wrong and fixing it. When it comes to treating patients of color, it's very, very, very important to understand that those issues exist and understand, why, not just knock the fact that they may have not caught up with their diabetes medications, or they might not be taking their heart disease meds, because it's important not just to treat the patient, but educate them as to, what's going on with their disease process. Because from a public health perspective, that's the only way we're going to change things, right?
Right.
From a dermatology standpoint, there was just a paper in one of the big journals about when you're just looking at the skin, the rashes in patients with COVID, 92% of the pictures that are in the journals are all light-skinned patients. There is less than 6% that are of skin of color. And so that just shows you, just from a skin color perspective, how even our research is biased towards patients that are not of color, to patients that are light-skinned. And so as a medical community, I urge all my colleagues to really think inwards as to what we're doing wrong and trying to fix it. And I think that if we do that, and maybe these social injustices will bring light to the disparities in medical care and help us change things from a reform level. So I'm crossing my fingers. I do see a lot of change. I see a lot of people talking about changing things. Hope it gets done at the lawmaking level, at the community level, and also at the healthcare level.
Yeah, very important point right there. Well, thank you so much for your time here on ITV Gold. I'd love for you to give a message out to our audience and what you think is pertinent for the next couple of weeks in terms of social distancing or any measures. But also, I would love for you to give a message out to all of your, fellow medical professionals, all the healthcare workers in this country.
So to everybody that's watching, I just want to say stay home for now, stay safe, stay healthy. I think the most important thing is we're entering this next phase to reintegrate into society. Just make sure that, not everything that you hear out there is necessarily true. Do your research. Make sure you examine the trusted resources to see how to really do that. Make sure you're wearing a mask whenever you go out, even if it's to go get the mail, even if it's just to go downstairs and walk the dog, because you can contract this virus anywhere. They talk about spreading this virus may not spread in grocery stores. It may very well spread in grocery stores by touching objects, things like that. There's no evidence to say that it doesn't. So wear gloves if you're going to go to the grocery store. Try to limit the amount of times you go there, the amount of time you spend in there, your interactions with the people there, and just stay 6 feet apart. If everybody individually consciously takes that effort, I think we can do a lot better as a society in limiting the spread, even if we do venture out. I think for businesses, for our social sake, it's very important to reintegrate with society. I don't believe that we should be quarantined for others to be quarantined for the next 6 months. Yeah. So I think that our viewers should definitely figure out a way to safely reintegrate society. And to my medical community, I want to say, stay strong, guys. You guys have done a wonderful job. The people that are working from day one to right now in the ICUs and the emergency medicine, our nursing staff, our respiratory therapists, people that are just working day in and day out from day one. You guys are heroes, and just keep doing what you're doing.